Hello, everyone. This is Kellen and Braden, and today we are comparing allografts to autografts for ACL reconstruction.
All right, so a little context into ACL reconstruction. The anterior cruciate ligament is one of the most commonly injured ligaments in sports, and with that, there's a lot of reconstructions that occur every year. But there's currently no gold standard as to what types of grafts are used and where those grafts are taken from. So, from the research we compiled for this analysis, we found that the two main locations for grafts, regardless of whether it's an autograft or an allograft, is either from the patellar tendon or the hamstring tendon. So with the patellar tendon, the graft is going to be taken from the bottom of the patella down to the tibial tuberosity. And it's going to possess bone plugs on both ends of the graft, which are significant because those bone plugs have been shown to result in faster incorporation rates. And incorporation, also known as ligamentization, is essentially the process in which a connective tissue changes and becomes a ligament, taking on the responsibilities and role of a ligament. So because of those bone plugs, the patellar tendon graft shows faster rates of incorporation. However, those bone plugs being removed also result in a high probability of anterior knee pain. And there's also a wide variety of other complications from the patellar graft, including patellar tendinitis and potential for patellar tendon rupture. So the other popular alternative is going to be the hamstring graft. This graft is usually taken from the semitendinosus tendon on the medial aspect of the knee. And one of the advantages of this graft is that it leaves the patellar tendon unaffected, which essentially means that our extension complex in our knee is still healthy. However, since you are taking a piece of the hamstring tendon, it usually results in weakness and sometimes atrophy of the hamstring muscle group. So our PICO question for this analysis was, in patients receiving ACL reconstruction, are allografts more effective in reducing recovery times compared to autografts?
So, what is an allograft? Well, an allograft is a piece of connective tissue which is harvested from a separate individual and, in many cases, from a cadaver. Uh, Potential benefits of an allograft are faster surgical time and recovery rates, as well as no donor site morbidity. Donor site morbidity is basically side effects. So, for example, if you were to receive an autograft from your hamstring, then you would have weakness in your hamstrings. Some of the potential drawbacks are the possibilities of spreading infectious diseases. Um, and so, because of this, individuals are more hesitant to receive an allograft. Today, allografts undergo a series of blood tests as well as wash and sterilization. However, the chemicals used and the duration of refrigeration for storing deteriorates the quality of tissue altogether.
So what is an autograft? An autograft is a piece of connective tissue which is harvested from the same individual who's receiving the surgery. So potential benefits of an autograft are essentially that they have shown to incorporate or ligamentize faster than allografts, being that the tissue is coming from your own body. And also, there's a much less risk of disease transmission with autografts. However, the potential drawbacks are that there's a high likelihood of complications or morbidity at the donor site, meaning that if you get your graft from your patellar tendon, there's a high likelihood of anterior knee pain. And if you get your graft from your hamstring tendon, there's a high likelihood of hamstring weakness or spasms potentially.
Compared to autografts, allografts lead to faster recovery but have been shown to have higher rates of failure. One reason for this is because with faster recovery time and no donor site morbidity, athletes often feel fully recovered, when in reality they have not allowed the allograft to fully incorporate as a ligament. Another reason for this, as I mentioned before, the sterilization and refrigeration of allografts can also play a significant role in having higher rates of failure.
So to conclude, we recommend that graft selection for ACL reconstruction should be made on an individual basis. To summarize the research in this analysis, we say that autografts have longer recovery but stronger results due to the presence of donor site morbidity. However, research also shows that autografts incorporate and ligamentize faster than allografts. So, because of this, we recommend autografts for patients who are either young or athletes because those patients need a strong ACL in order to perform. However, those patients are likely to be able to go through a more intense rehabilitation cycle. In contrast, we found that allografts have faster recovery, however, they have weaker results, and that's due to no donor site morbidity. However, there is the potential for deterioration of the graft from the refrigeration and sterilization process, as well as we note that anybody receiving an allograft should be closely monitored due to the potential for them to feel prematurely rehabilitated. So because of this, we recommend that anybody who is middle-aged or non-athlete and they're seeking the fastest rehabilitation possible, an allograft might be best for them. So these are our references used, and please ask us any questions you have. Thank you so much.